Most doctors look you in the eye and tell you your dry eyes are from too much screen time. Your dry mouth? Drink more water. Your exhaustion? You are probably just stressed. What they are not telling you is that those three symptoms together are the earliest warning signs of a disease that quietly destroys your brain, attacks your nerves, and raises your risk of cancer by 44 times. 4 million Americans have it right now. And most of them have no idea. Today a specialist is going to walk you through exactly what Sjogren's disease is doing inside your body, from the very first symptom, all the way to lymphoma and brain damage, and what you can do before it is too late. If that sentence just landed for you, if something in what I've described so far sounds familiar, I've put together a symptom map that shows exactly how this condition progresses, what shows up at each stage, and where the standard tests are most likely to miss it. Type symptom map in the comments right now and I'll send it to you directly. Because what I'm about to show you next is why that map matters more than most people realize, and why the stage you're in changes everything about what happens next. Here is the problem with Sjogren's disease. When a patient walks into a doctor's office with dry eyes and a dry mouth, they walk out with eye drops and a bottle of water. And the disease keeps destroying them from the inside. Nobody connects the dots. Nobody asks the deeper question. Nobody says, wait, why are your eyes dry? Why is your mouth dry? Why are you exhausted every single day no matter how much you sleep? Instead, you get a prescription for artificial tears, you get told to stay hydrated, and you go home thinking you are fine. You are not fine. The disease is progressing while you are being handed eye drops. Sjogren's is a systemic autoimmune disease. That means your own immune system, the system that is supposed to protect you, has turned against you. It is attacking the moisture-producing glands in your body, your tear glands, your salivary glands, and then it spreads far beyond that. It attacks your joints, your kidneys, your lungs, your heart, your pancreas, your nervous system, and most frighteningly, your brain. This is not a disease that stays in one place. This is a disease that moves through your body like a slow fire, and by the time most people realize it is there, the damage has already been building for years. Sjogren's is the second most common rheumatic autoimmune disease in the United States. It is 3 times more common than lupus. 3 times more common than multiple sclerosis. And yet if you walked outside right now and asked 100 random people if they had heard of Sjogren's disease, the overwhelming majority would say no. This is a disease affecting millions of people that most of the world has never heard of. That is not an accident. That is a failure of awareness, a failure of medical education, and in many cases a failure of the healthcare system to take the people who have it seriously. 90% of adults diagnosed with Sjogren's are women. And that matters, because for decades women presenting with fatigue, joint pain, brain fog, and dry eyes have been told they are anxious, depressed, or simply tired from the demands of daily life. Their symptoms are dismissed. Their concerns are minimized. And the disease grows. It spreads. It causes damage that cannot be undone. Because nobody stopped to ask the right question. The average time from first symptoms to diagnosis is measured in years, not weeks. For many patients it takes far longer than that. Every single day that goes undiagnosed, the inflammation is spreading through their body, damaging tissue, attacking nerves, and in some cases laying the groundwork for cancer. If this is the first time you are hearing about Sjogren's, type shocked in the chat. Let us see how many people had no idea this disease existed. Because you are not alone. And the more people who know about this disease, the more lives we can save. So what is the very first sign? What is the symptom that shows up before anything else, the one that people dismiss for years before they ever get a diagnosis? It is almost always dry eyes. But not just any dry eyes. We need to be very specific about what we mean here, because there is a difference between the kind of dry eyes you get from sitting in front of a screen all day and the kind of dry eyes that are trying to tell you something is seriously wrong inside your body. The dry eyes of Sjogren's are persistent. They are progressive. They are the kind that wake you up in the middle of the night. They are the kind where you open your eyes in the morning and they feel sealed shut, almost glued together, because your tear glands have not been producing enough moisture overnight. They are the kind where you put in artificial tears and get 30 minutes of relief before the burning and the grittiness comes back. They are the kind where your eye doctor keeps changing your prescription for drops but nothing ever really works, because the problem is not your eyes. The problem is your immune system. And paired with those dry eyes comes a dry mouth that is unlike anything most people have experienced before. Not the kind of dry mouth you wake up with after sleeping with your mouth open. The kind of dry mouth where swallowing a piece of bread without a drink of water is genuinely difficult. The kind where you wake up in the middle of the night and reach for water because your mouth feels like sandpaper. The kind where you go through extraordinary amounts of water in a day and still feel parched. That is not dehydration. That is your immune system destroying the salivary glands that are supposed to keep your mouth moist. But here is what makes Sjogren so dangerous, and why the dry eyes and dry mouth are just the beginning. In a major study on Sjogren's patients, 8 symptoms were reported as having the most severe impact on daily life. Fatigue at 79%. Dry eyes at 75%. Dry mouth at 73%. Joint pain at 65%. Trouble sleeping at 64%. Eye discomfort at 60%. Muscle pain at 56%. And brain fog at 54%. More than half of all Sjogren's patients are dealing with brain fog severe enough to significantly impact their quality of life. And that brain fog is not tiredness. That brain fog is not stress. That brain fog is neurological inflammation. Your immune system is beginning to cross the blood-brain barrier and attack your central nervous system. And here is the fact that changes everything. In 25 to 60% of all Sjogren's cases, the neurological symptoms appear first, before the dry eyes, before the dry mouth, before anyone even suspects an autoimmune disease. They precede the actual diagnosis of Sjogren's by an average of 2 years. 2 full years of neurological damage before anyone even knows what is happening. 2 years of going to neurologists and getting normal test results. 2 years of being told it is stress or anxiety or that you just need more sleep. 2 years of damage building up inside your nervous system while the real cause goes undetected. Type brain fog in the chat if you have been dealing with unexplained cognitive issues, memory problems, or mental exhaustion that no doctor has been able to explain. Because if you have, Sjogren's disease needs to be on your radar starting right now. Now we need to talk about the conversation that most Sjogren's patients are never having with their doctors. And this is the one that matters most. This is the one that can mean the difference between catching something early and catching it too late. People with Sjogren's disease are 44 times more likely to develop lymphoma than people without it. Read that again. 44 times. Not 44% more likely. 44 times more likely. That is not a slightly elevated risk. That is a risk so dramatically elevated that every single person with Sjogren's disease should be having a direct conversation with their doctor about lymphoma surveillance every single year. Sjogren's carries the highest risk of lymphoma development among all autoimmune diseases. Not just a high risk. The highest. Above lupus. Above rheumatoid arthritis. Above every other autoimmune condition. And yet the majority of Sjogren's patients are never told this. They are handed their diagnosis and sent home with information about artificial tears and saliva substitutes, and nobody says to them, by the way, you are now in a high-risk category for blood cancer and here is what we are going to do to watch for it. The vast majority of lymphomas that develop in Sjogren's patients are B-cell non-Hodgkin's lymphomas, specifically a type called MALT lymphoma, which stands for mucosa-associated lymphoid tissue lymphoma. This type of lymphoma most commonly develops in the salivary glands, particularly the parotid glands, which are the large glands located just in front of your ears that you can feel when you chew. Here is how it happens. Sjogren's causes the immune system to flood the glands with immune cells called lymphocytes. This flooding is what creates the inflammation and the destruction of the glands. But year after year, those lymphocytes do not just cause damage and leave. They accumulate. They stay. They proliferate. They multiply. And when B cells proliferate unchecked inside glandular tissue for long enough, the transition from chronic inflammation to lymphoma is not a dramatic sudden event. It is a slow, quiet progression that is happening inside the gland while the patient continues their life, unaware. After 20 years of living with Sjogren's disease, close to 1 in 5 patients will develop lymphoma. 1 in 5. Not 1 in 500. Not 1 in 50. 1 in 5. And the warning signs are almost always present before the diagnosis, but patients miss them because they look so similar to ordinary Sjogren's activity, and doctors miss them because they are not looking specifically for them. The warning signs that Sjogren's is progressing toward lymphoma include persistent enlargement of the parotid glands that does not go away between flares. These are the glands just in front of your ears, and when they swell and stay swollen, that is different from the normal waxing and waning of Sjogren's symptoms. It also includes swollen lymph nodes in the neck, armpits, or groin that persist for weeks. Fatigue that is getting progressively worse rather than fluctuating with disease activity. Unexplained weight loss that you did not try to achieve. And night sweats that drench your clothing or bedding while you sleep. Research published in 2024 confirmed that persistent parotid gland enlargement was found in more than 50% of Sjogren's patients who went on to develop lymphoma. If your glands in front of your ears are chronically swollen, that is not just a Sjogren's flare. That is a signal that needs to be investigated immediately with imaging. Type glands in the chat if you have noticed swelling near your jaw, neck, or ears that keeps coming back. Your answer could help someone else watching this right now recognize that their symptom is something to take seriously. This next segment is the one most people do not know exists. Because when people think of Sjogren's, even people who have been diagnosed with it, they think dry eyes and dry mouth. Nobody talks about what this disease does to the brain. Nobody talks about the neurological destruction that can be happening silently, progressively, for years before anyone connects it to Sjogren's. And that silence is costing people their cognitive function, their nerve health, and in some cases their quality of life in ways that are genuinely devastating. Neurological complications are not rare in Sjogren's disease. Estimates vary widely across studies because the disease is so frequently misdiagnosed and because the neurological symptoms are so often attributed to other causes. But research consistently shows that neurological involvement affects a significant portion of Sjogren's patients. And in those where neurological disorders appear after the initial diagnosis, they tend to show up 6 to 8 years into the disease course. 6 to 8 years of progression before the nervous system involvement becomes undeniable. The most common neurological complication is peripheral neuropathy. This is nerve damage that affects the peripheral nervous system, the vast network of nerves outside the brain and spinal cord that controls sensation and movement throughout your body. In Sjogren's, peripheral neuropathy most often presents as sensory polyneuropathy, meaning it affects sensation rather than movement. Patients describe it as numbness, tingling, burning, and pain in the hands and feet that never fully goes away. Some describe it as walking on pins and needles constantly. Others describe their feet as feeling wrapped in cotton, as though the sensation is muffled and muted. Some describe burning so severe it keeps them awake at night. And because these symptoms can look like diabetic neuropathy or vitamin deficiency neuropathy or dozens of other conditions, the Sjogren's connection is often the last thing anyone considers. Then there is small fiber neuropathy, a specific type of nerve damage that affects the tiny nerve fibers just beneath the surface of the skin. These fibers are responsible for detecting pain, temperature, and light touch. When Sjogren's damages them, the result is patchy burning, stinging, and hypersensitivity across the body. Patients describe areas of skin that feel like they are on fire. They describe sensations of insects crawling under the skin. They describe pain from the simple touch of clothing against their body. And because small fiber neuropathy does not show up on standard nerve conduction studies, which only test the larger nerve fibers, it frequently goes undetected. A patient can have profound small fiber neuropathy with completely normal standard nerve testing, be told their nerves are fine, and continue suffering with no explanation for years. Central nervous system involvement, meaning the brain and spinal cord themselves, is less common than peripheral neuropathy but profoundly serious when it occurs. It can include cognitive dysfunction, which presents as memory loss, difficulty finding words mid-sentence, slowed thinking and processing speed, and an inability to maintain concentration for sustained periods of time. It can include aseptic meningitis, which is inflammation of the protective membranes surrounding the brain and spinal cord with no bacterial or viral infection present. The immune system itself is creating the meningitis. It can include optic neuropathy, where the immune system attacks the optic nerve and causes progressive visual loss, sometimes bilateral, sometimes leading to blindness if not recognized and treated. And in some cases the brain MRI shows hyperintense white matter lesions, areas of inflammation and damage in the white matter of the brain that look so similar to the lesions seen in multiple sclerosis that patients are formally diagnosed with MS, put on MS medications, and treated for years for a disease they do not have, while the actual cause, Sjogren's, continues unchecked. The overlap between Sjogren's and multiple sclerosis at the neurological level is one of the most complex and contested areas in autoimmune medicine. Rheumatologists and neurologists are still working to understand where one ends and the other begins, and how often Sjögren's is either misdiagnosed as MS or coexisting with it simultaneously. What is clear is that patients are falling through the cracks of this diagnostic uncertainty at enormous cost to their health. And the cognitive disorders, the memory deficits, the attention problems, the word-finding failures, the executive function breakdown, research has directly linked these to disease activity. The more active and uncontrolled the Sjögren's inflammation, the worse the cognitive damage. Which means that every month, every year that passes without proper diagnosis and treatment is not just lost time. It is lost cognitive function. It is neurological damage accumulating. It is not brain fog. It is brain damage. And brain damage that is not stopped does not repair itself. Type work UP in the chat if this segment just changed the way you see this disease. Because we want to know how many people watching this had no idea that Sjögren's was doing this to the nervous system and the brain. Here is a question that should make every person watching this video genuinely angry. Why does a disease this common, this serious, this well documented, and this dangerous take years for most patients to finally get diagnosed? The answer is layered. And it starts with the symptoms themselves. Sjögren's is a master of disguise. Its symptoms do not announce themselves as Sjögren's. They announce themselves as other things. More familiar things. More dismissible things. The fatigue looks exactly like depression. The joint pain looks exactly like fibromyalgia or early rheumatoid arthritis. The brain fog looks exactly like anxiety or burnout or hormonal imbalance. The dry eyes look exactly like prolonged screen exposure. The dry mouth looks exactly like insufficient fluid intake. And a chronic cough with no infection looks like acid reflux or post-nasal drip. Each symptom on its own sends you to a different specialist who is looking only at their own piece of the puzzle. The eye doctor sees dry eyes and gives you drops. The GP sees fatigue and sends you for a thyroid panel that comes back normal. The rheumatologist checks for lupus, finds nothing, and discharges you. The neurologist sees the tingling and numbness and orders nerve conduction studies that come back normal because the small fiber neuropathy is not visible on those tests. The psychiatrist sees anxiety and fatigue and prescribes antidepressants. And nobody, not one of those specialists, steps back and looks at the entire picture and says, wait. These symptoms together. Dry eyes. Dry mouth. Fatigue. Brain fog. Joint pain. Nerve symptoms. There is a disease that causes all of these at once. And we need to check for it. To make the diagnostic challenge even greater, in seronegative Sjögren's, the standard antibody blood tests come back completely normal. The anti-SSA and anti-SSB antibodies, also written as Rho and La antibodies, are the markers that doctors rely on to confirm a Sjögren's diagnosis. But these antibodies are absent in a significant portion of patients who have the disease. Which means you can have full-blown Sjögren's disease, with glandular destruction, neurological involvement, and elevated lymphoma risk, and your blood work looks perfectly clean. A doctor looks at your negative antibody panel and tells you that you do not have Sjögren's. And they are wrong. The only definitive test in seronegative cases is a lip biopsy. This is a minor procedure performed under local anesthetic where a tiny piece of tissue is taken from the inside of the lower lip. The tissue is then examined under a microscope for focal lymphocytic infiltration, the characteristic clustering of immune cells around the glands that is the hallmark of Sjögren's disease. A positive lip biopsy confirms the diagnosis even when all the blood tests are negative. Most patients are never offered this test. Most patients are never even told it exists. And so they continue for years, going from doctor to doctor, being told their tests are normal, while the disease progresses inside them. So if you are watching this and you have dry eyes, dry mouth, chronic fatigue, joint pain, brain fog, nerve symptoms, or any combination of those symptoms, here is exactly what you need to do. Write this down. Go to your doctor and ask for an ANA panel. Ask specifically for anti-SSA and anti-SSB antibody testing by name. Ask for a Sjögren's test, which is a simple in-office test that measures how many millimeters of tears your eyes produce in 5 minutes. Ask about a lip biopsy if your blood tests come back negative but your symptoms persist. And ask for a referral to a rheumatologist who has specific experience with autoimmune disease and specifically with Sjögren's. Do not accept a dismissal. Do not let anyone tell you that your symptoms are normal or that you just need to manage stress better. You know your body. Push for answers. Type years in the chat if it took you or someone you love more than a year to get a diagnosis for an autoimmune condition. Let people watching see that they are not alone in this fight. There is currently no cure for Sjögren's disease. That is the difficult truth that every patient deserves to hear plainly, without softening. But here is what is equally true. There is a framework for managing this disease. And following that framework aggressively and consistently is the difference between a patient who remains stable for decades with a good quality of life, and a patient who progresses to organ damage, severe neurological complications, or lymphoma. The framework matters. The monitoring matters. And starting both as early as possible matters more than almost anything else. Step 1 is confirmed diagnosis, followed immediately by annual lymphoma surveillance. This is non-negotiable. Every single Sjögren's patient, from the day of diagnosis, should be having a conversation with their doctor about lymphoma monitoring. That means annual examination of the parotid glands. It means assessment of lymph nodes throughout the body. It means monitoring of specific blood markers including complete blood count, serum protein electrophoresis, and cryoglobulins, which are proteins that can indicate B-cell activity. It means that any persistent glandular swelling gets imaged. Not observed for a few more months. Imaged. An ultrasound of the major salivary glands can identify structural changes that are early indicators of lymphoma transformation. Every Sjögren's patient deserves this surveillance every year. Step 2 is systemic inflammation control through medication. Hydroxychloroquine, an antimalarial drug that has been used safely for decades in autoimmune conditions, is the most commonly prescribed systemic treatment for Sjögren's disease. It works by dampening the overactive immune response that is driving the glandular destruction and systemic inflammation. Studies have shown it can reduce disease activity, improve fatigue and joint symptoms, and may have a role in reducing lymphoma risk over the long term. For patients with more severe systemic involvement, including significant glandular swelling, kidney or lung involvement, or active vasculitis, stronger immunosuppressive medications are required. Rituximab, a biologic medication that targets B cells specifically, has shown meaningful benefit in patients with high disease activity and is particularly relevant given the B cell-driven nature of both the disease and its lymphoma complication. Step 3 is neurological surveillance and early intervention. This cannot be overstated. Any Sjögren's patient who develops numbness, tingling, burning, weakness, problems with balance, cognitive changes, word-finding difficulties, visual disturbances, or any other neurological symptom needs an immediate referral to a neurologist who is informed that the patient has Sjögren's disease. The neurologist needs to evaluate not just with standard nerve conduction studies, but with additional testing that can detect small fiber neuropathy, including skin punch biopsy to measure intraepidermal nerve fiber density. When neurological involvement is confirmed, treatment options including immunosuppressive therapy, intravenous immunoglobulin, and in some cases plasmapheresis have shown meaningful benefit in halting progression and in some cases partially reversing nerve damage that has not been present for too long. The key phrase is caught early. Nerve damage that has been accumulating for a decade is far harder to address than nerve damage that is identified and treated within months of onset. Step 4 is consistent lifestyle management of systemic inflammation. Sleep deprivation activates inflammatory pathways and drives immune dysregulation. Chronic stress does the same. Poor sleep and high chronic stress do not cause Sjögren's, but they create an internal environment where the immune system's overactivation is amplified and harder to control. Prioritizing sleep architecture, managing stress through whatever sustainable methods work for the individual, and maintaining consistent physical activity at a level that the body can tolerate without triggering post-exertional flares are all foundational components of managing Sjögren's over the long term. These are not replacements for medication. They are the environment in which medication works more effectively or less effectively depending on how well they are maintained. Step 5, and this must be said with complete seriousness, is relentless self-advocacy. The research on Sjögren's is clear. The facts about its systemic nature, its neurological complications, and its lymphoma risk are documented in peer-reviewed literature that any doctor can access. If your doctor is dismissing your symptoms, find a doctor who will not. If you are being told that your fatigue is just life, or your brain fog is just stress, or your nerve symptoms are nothing to worry about, find someone who will take those symptoms seriously. You are entitled to a complete evaluation. You are entitled to annual monitoring. You are entitled to answers. Do not stop until you get them. Type protocol in the chat if you are going to bring this information to your next doctor's appointment. Save this video. Share it. Because the more people who know what to ask for, the fewer people who will spend years getting dismissed while this disease builds inside them. She was 36 years old. A primary school teacher who loved her job, loved her students, and spent her evenings reading. She had been to 4 different doctors over the course of 3 years, with what felt to her like an overwhelming and growing list of symptoms. She was always exhausted, a bone-deep fatigue that did not improve no matter how early she went to bed. Her eyes burned every single morning when she opened them. She kept a glass of water on her nightstand because her mouth was so dry in the night that it woke her up. And then there was the thing in her feet. A creeping numbness that had started in her toes and slowly, over about 18 months, had worked its way up toward her ankles. It was not painful exactly. It was more like her feet were slowly disappearing. Like the sensation was being dialed down toward zero. Dr. 1 told her she was dehydrated and probably not sleeping well. Dr. 2 ran a thyroid panel, found nothing, and suggested she consider talking to someone about anxiety. Dr. 3 checked her eyes and told her to take breaks from screens and use lubricating drops. Dr. 4, a general rheumatologist who checked for lupus and rheumatoid arthritis, found her standard antibody panels negative and told her that her test results did not support an autoimmune diagnosis. She was prescribed antidepressants. She was told to exercise more. She was told to reduce her workload and manage her stress better. She went home and cried, not because she was depressed, but because she knew something was wrong inside her body and nobody would listen. What she actually had was Sjögren's disease. Not the simplified version of Sjögren's that gets described as a dry eyes and dry mouth condition. The real version. The systemic version. She had active peripheral neuropathy already causing measurable damage to the nerves in her lower legs. She had parotid glands that had been very gradually enlarging over the previous 12 to 14 months. She had anti-SSA antibodies, but they had not been tested, because not one of her 4 doctors had thought to ask for them specifically. When she finally found a rheumatologist who specialized in autoimmune disease, who sat with her for an hour going through her entire symptom history, who noticed the subtle glandular fullness in front of her ears, who ordered the complete panel including the specific antibodies and the Sjögren's test and then referred her for a lip biopsy, the diagnosis came back within 2 weeks. Sjögren's disease, confirmed. And because that rheumatologist understood the lymphoma risk and took it seriously from day one, an ultrasound of her parotid glands was ordered within the same month. Early-stage malt lymphoma, caught in the salivary gland. Treated with targeted therapy. She is in full remission. She tells everyone now. She tells the parents of her students. She tells her colleagues. She posts about it online. She says, "Dry eyes saved my life." And she means it. Not because dry eyes are inherently dangerous. But because she finally, after 3 years and 4 dismissals, refused to accept that her symptoms were nothing. She walked into that 5th appointment and said, "I am not leaving until someone explains what is happening to me." That decision, that refusal to give up on her own body, is what caught the lymphoma early enough to treat it. The first symptom was always there. The system was not listening. She made the system listen. If this story hit home, type her in the chat. And if you know someone who has been dismissed by doctor after doctor while their symptoms keep growing, share this video with them right now. It might be the most important thing they watch this year. Because someone out there is sitting exactly where she was sitting 3 years ago. And they deserve to know what she knows now. Here is everything we covered today, because you deserve to leave this video with clarity. Sjögren's disease affects 4 million Americans. It is the second most common rheumatic autoimmune disease in the country. It is 3 times more common than lupus and 3 times more common than multiple sclerosis. And the vast majority of people who have it do not know it. The first sign is almost always dry eyes, but not ordinary dry eyes. Persistent, progressive, unresponsive dry eyes that are trying to tell you something is happening inside your immune system. Paired with chronic dry mouth, unexplained fatigue, joint pain, and brain fog that medicine cannot explain away. In 25 to 60% of cases, the neurological symptoms appear before the diagnosis. Before the dry eyes are ever connected to a disease. Before anyone knows to look for Sjögren's. 2 years of neurological damage building in silence. People with Sjögren's are 44 times more likely to develop lymphoma than people without it. That is the highest lymphoma risk among all autoimmune diseases. After 20 years with the disease, 1 in 5 patients will develop it. The warning signs are swollen parotid glands in front of the ears that stay swollen, lymph nodes that do not resolve, worsening fatigue, unexplained weight loss, and night sweats. These are not just Sjögren symptoms. These are signals that need imaging and investigation immediately. The brain involvement is real. The nerve damage is real. The cognitive destruction is real. It is documented in peer-reviewed research. It is happening to patients right now who have no idea that Sjögren's is the cause. If you have dry eyes that will not go away, push harder. Ask for the ANA panel. Ask for anti-SSA and anti-SSB antibodies specifically. Ask for the Sjögren's test. Ask about a lip biopsy if your blood work comes back negative but your symptoms are real. Find a rheumatologist who specializes in autoimmune disease and will not dismiss you. And if you already have a Sjögren's diagnosis, make sure your doctor is monitoring you for lymphoma every single year. Not every few years. Every year. Annual surveillance of your glands, your lymph nodes, and your relevant blood markers is not optional. It is the standard of care you deserve and must advocate for. Do not wait for this disease to introduce itself louder. Do not wait until the lymphoma is advanced. Do not wait until the nerve damage is irreversible. Do not wait until the cognitive decline is severe enough that people around you notice. Act now. Ask the questions now. Push for the answers now. Type Sjogren's in the chat if this video taught you something today that you did not know before you clicked on it. Drop a comment below telling us how long it took you or someone you love to get a diagnosis. Your story matters. Your experience matters. And it might be exactly what the next person watching this video needs to read in order to finally believe that their symptoms are real, their struggle is valid, and that they deserve answers. If nobody in your life is talking about Sjögren's, you just became the person who does. Share this. Because awareness is the first treatment this disease never gets.